So Nelson Anderson is with us today. Why don't you tell us about how you found out about Warrior Medical Group?
How I found out about Warrior Medical Group starting was actually a friend from school told me that Warrior Medical Group was starting in our area and expressed, why they were different as a what I would call a doctor's office, right?
Mm-hmm. So what was that difference? What really stood out to you about us?
Sure. Well, number one, let me walk back through my journey of going to the doctors. I'm a male, so I don't go to the doctors. So if something was ever wrong with me, it was usually me going to a patient first, or there was another primary care doctor who I didn't really have a relationship with. I just saw whoever was available at that time. So really major medical problems or minor, like, poison. I'm allergic to poison ivy. So poison ivy that wouldn't go away, or a really bad cold or a bad pain. I would go into one of these places and just see whoever. So I wasn't comfortable going. There was always a long wait. And there was nobody actually looking after my overall health care, right?
So what I'm hearing is when you went to these other providers, there's no continuity of care. You're kind of just a diagnosis, see them, turf them, keep going.
Correct.
How has your perception of the medical establishment changed since joining Warrior Medical?
Right. So I was, to answer your previous question too, is like, how it was explained what Warrior Medical was. It was like, hey, they're personal. You're going to have the same doctor and they're going to look after your care. So obviously in getting older, I'm now 42. So my wife's told me about my high blood pressure and, getting all my health items in check. And making sure that I'm there for her for the long run. The kids are about out of the house and she wants me around. I can't believe that. But, how my view has changed is actually like a partner to make sure that I am getting taken care of and I'm living my optimal life. I think that, a younger age or feeling good covers up a multitude of problems.
Absolutely.
And so then when there's a lot of things that can go on with the body that I'm finding out that a high energy level will cover up. And that's been my story of, needing to take care of my body better with my high blood pressure and other things that are going on.
So you found that continuity of care that you were kind of lacking. How is the communication been with us as Warrior Medical Group?
Oh, Tim, the communication's fantastic. So I'll give you a real life example. Maybe we don't want this for all patients. Just kidding. But I've texted Tim telling him, hey, I'm deathly sick. I have a cold, respiratory. He asks for my symptoms. I run through that with him, and next thing you know, he's got a prescription at my local pharmacy that I can pick up the same day.
So how does this form of communication differ than what you were getting in the traditional system?
Oh, it would take a whole day out of my life. Whereas this, it's I still have to show up to work. Just because I'm sick doesn't mean that I get to stop working. So for me to be able to text somebody and get answers and get help is complete. It's a day's worth of my life, and that's doesn't compare to the pennies that I pay for the service.
Do you feel like that you've been able to become more of a participant in your own healthcare now?
Oh, definitely. I'm able to, after the dialogue has started, then you really get in touch with how you're feeling. And once you have a baseline, then you can compare and contrast it. So, being able to come in and talk to you of like, hey, yeah, this has changed, this hasn't changed, and just being in touch. And I think that you've been able to facilitate that conversation and also, bring out what is going on. Because I think it's really important that if you don't know anything's going on, how can you solve any problems? So developing that dialogue and that conversation is super important.
So as a patient, what would be your one takeaway from Warrior Medical Group, or something that you would want to pass on to someone to encourage them to come see us?
Yeah, especially for guys. Again, I started this conversation with, we're guys are pretty hard-headed in general, and they put their health and their body well-being on the back burner. We're men. We're going to push through it, and we don't take care of ourselves, quite frankly. And I would strongly urge everybody that, hey, call Warrior Medical Group. They're going to walk alongside of you, take care of you. And it's not going to be a time suck, which is, was really my concern of, walking into a relationship. And it's also great that it's a practice that you're welcomed in, and you don't feel out of place. It's very comforting.
And so to sum up, what I'm hearing is, we're providing better care for you. We're first of all providing you better access, which then gives you better care and overall better outcomes for your health.
Definitely. Never felt better, Tim.
That's great, Nelson. Thank you for joining us today.
Yeah, thanks for having me.
So I'm Dr. Tim Romanowski, and I want to thank Nelson Anderson today for sharing his patient experience with Warrior Medical Group. If you would like to contact us, please visit our website at www.warrior-medical.com.